Hi, my name is Chantal Snyder, and I am doing my clinical reflection video for Nursing 335. The purpose of this video is to explain how I met the 8 nursing objectives for this semester. So, objective number 1 is apply knowledge from previous courses in the physical, social sciences, humanities, in nursing, in meeting the multidimensional needs of individuals, groups within the local geographic area. So I felt I met this by signing up for different clinical areas in leadership. So what I mean by this is I set up for myself 3 different times I was with Professor Wagner in her 311 lab. So I was able to be the leadership person in lab in case her students had questions in regards to head to toe assessments, abdominal assessments, and skin assessments. That's what we covered for those days. Those are my favorite. So I felt that I met that just by applying what I knew previously and what I had learned previously in courses that I can help them apply what I know. I also had signed up for a clinical 309 clinical over at Cedar Crest Hospital. And I was with the same students during their clinical rotation over there as well. So I was able to help them with vital signs, with bathing patients, with changing bed linens, things of this nature. And again, it's all things that we have learned or that I have learned that I was able to help apply with them. Moving on to objective number 2, that is to apply the basic principles of ethics, management, and leadership to meet the needs of patients and their families. So I basically put in that my community leadership was part of this. And I have, as far as leadership community, I had gone to the senior center, I think it was the Active Life Center. I was there 3 times, and I helped them with bingo, with running around and calling back the bingo. I know some of the volunteers there are, they've had knee replacements, they've had hip replacements. They're not, they're a lot older. So they do ask for help. And I felt that I met this just by meeting those needs. It's as far as not just running around, but just by help being organized. They need organization. So by me coming in there and saying, okay, let's put together your packages for your bingo. I will do this for you. Or, yes, I will help you put the money together for this. And I was able to do that and help them. It was about planning and organizing, and that's what really helped them. So for me, I was able to do that and meet that objective for them and for myself. So objective number 3 is to evaluate the effectiveness of communication in promoting the optimal health of patients and their families. So for number 3, I used my advanced practice and my recruiting event. The advanced practice was, I was in the nursing float pool over at Muhlenberg. And that, I have to say, was more than just the nursing float pool. I met this objective by understanding budgeting and by being able to go around and talk with patients. This director that I was with had to physically walk around and talk to patients and find out what we're doing wrong or what we're doing right, and if we're doing both of those things. Ethically, I was able to really demonstrate my professional line of communication and just, follow this person around. But as far as being able to sit there and be a part of it and understand that I was there for somebody to talk to, I felt that I met this goal. and being able to collaborate, effectively with the patient and their families was a big deal for not just me, but for the supervisor that I was with, as well as the patients and their families. So number 4 is critically analyze and integrate leadership research findings into the total plan of care for a selected group of patients and their families. So this could go a couple of different things. So I use this specifically for the research area because I did find 3 specific topics that I researched, and I think I did upload one, but I would like to bring them to post-conference because I feel that they are very important. One of which is nurses-led telehealth clinic during COVID-19. And this applies to when I went to the AICU, which is a remote ICU. So this can kind of correlate with that as well. I felt that I met this because I did actually do a lot of research. I did have 3 different research articles that I have that actually do correlate with ethics, and I'll be able to bring those along during post conference. And as I said, the most important to me was the telehealth, and then of course there's 2 others relating to the nursing ethics in management and how they perceive it on a nurse's end, which I think is super important as well. Number 5 was to apply the principles of ethics, advocacy, and teaching to the everyday care of patients and their families. So this, I felt that I met this by going to Harrisburg, and also by the peer leadership and by Good Shepherd. That was, I want to say, that was my interprofessional leadership. And I say that I met this by going to Harrisburg was because when Professor Driskinnis asked us to find our representative for a bill that we needed to talk about, we found him. And the problem was he wasn't in his office. He was already on the floor. So we couldn't actually ask him about the bill that we were looking for. So, but we did find him. So we did that. And as far as Good Shepherd goes, I did collaborate with patients, and I did talk with the manager and other nurses, and just kind of felt what was going on. And I did actually discuss different strategies with them to change how maybe a certain individual would be feeling. So not that I did it intentionally, I just wanted to hear really like where they were coming from. So I felt like I was able to put my principle of ethics towards the patient's advocacy and their autonomy as well. So number 6 is to formulate plans for continued personal leadership, growth, and development as an independent practitioner of nursing. So for that, I met that one by continued education and by wellness. So continued education, I had gone on to Nurse Blake, and I had fulfilled 6 hours of continued education, and you can do that online for free. And I had used everything that we're currently learning right now. So anything right now for pediatric care and for mom baby, that has been all on Nurse Blake website. So anything to do with that is what I used as for continuing education. So I have done that. And then as far as wellness goes, I have met my goal there. I had gone walking for 30 minutes, probably a good 7, 8 times with my husband. He and I had made an agreement that we would do that together. So I have that uploaded for you to see. Number 7 would be to recognize the role of the nurse in policymaking related to healthcare services at local, state, national, and global levels. So I felt that I met this particularly with my nursing supervisor. I actually hung out with a couple of the nursing supervisors that day. And they showed me around and they kind of explained policy and procedure and what they do, every day. This was a nighttime procedure. So it was very quiet. There wasn't much going on, but there was a lot of policy involved. So as far as an example, if there were conflict, which could happen, as an example, between two patients, or it could be between a patient and, say, a tech. It could be like a one-to-one, like a patient is sitting with the tech, or it could also be 2 nurses, 2 techs, or just 2 employees. I had asked her, what is your policy on dealing with that, especially at night when it's usually much quieter. And she did give me the whole rundown of how she herself deals with that. And it does seem that she's very laid back. So I was able to kind of apply that to what we have learned. So it was kind of nice to recognize the role and recognize how everything is put together. And I was able to see the strategy that she was using. She's very laid back. She's very laissez-faire. Whereas opposed to the other nurse, she wasn't as laid back. She was, but not as much as the other nurse that I was with. So it was pretty nice to see the 2 differences. And you can definitely see the delivery of healthcare was always the same. It was always great. And they always wanted to make sure that everybody was okay and they were doing okay. So that was always the same. So, and I want to see number 8. 8 was predict and describe potential ethical dilemmas within clinical, organizational, and professional nursing practice. So I had just put this specifically to ethics, and I felt like I used this a lot throughout everything that I did. So as an example, the non-maleficence. So when I had gone to Good Shepherd, there had been a patient that they were asking me about all the time, like, what do you think you should do? What would you do as a nurse? And I just felt as though it's up to the patient. And if I was treating this patient, this is what I would do. It's more so, it's an ethical, not a dilemma, but you can understand where the dilemmas would be. So I understood that. And that's where I would meet that. And I felt that I did. So it was kind to see all of that. So that wraps it up. I hope everything was met and everything has been uploaded. Have a good day.